Have you ever been told you have PCOS? And the very next thing you thought was, does this mean I can't get pregnant? If you've ever Googled PCOS at 2 a.m. and closed your phone feeling scared, confused, or hopeless, this video is for you. Because today, we're answering one of the most important questions women with PCOS ask. Can you still get pregnant naturally if you have PCOS? The answer may surprise you, but before we begin, if you care about women's health, fertility, and understanding your body instead of fearing it, make sure to subscribe and like this video so more women can find this information. Now, let's talk about PCOS, honestly. What PCOS really is. Polycystic Ovary Syndrome, or PCOS, is one of the most common hormonal conditions affecting women today. Yet it's also one of the most misunderstood. PCOS is not just an ovary problem. It's a whole-body hormonal and metabolic condition. It affects hormones, blood sugar, insulin, inflammation, ovulation, menstrual cycles. That's why symptoms can look different from one woman to another. Some women have irregular periods, acne or excess hair growth, weight gain, difficulty getting pregnant. Others don't have obvious symptoms at all, and that's exactly why so many women feel confused after diagnosis. Why PCOS affects fertility. Let's talk about fertility. In simple terms, for pregnancy to happen naturally, ovulation must occur. Ovulation is when your ovary releases an egg. In PCOS, ovulation often becomes irregular, delayed, or unpredictable. But here's something very important that most doctors don't explain clearly. PCOS does not mean you never ovulate. It means ovulation doesn't happen on a predictable schedule, and unpredictable is not the same as impossible. The biggest myth. PCOS means infertility. Let's clear this up right now. PCOS does not automatically mean infertility. In fact, many women with PCOS get pregnant naturally. Some conceive without ever knowing they had PCOS. Others conceive after making simple lifestyle changes. PCOS is better described as a fertility challenge, not a fertility sentence. The problem isn't that pregnancy can't happen. The problem is that your body needs better hormonal signals to ovulate consistently. And that brings us to the real root cause. Insulin resistance. The real reason. PCOS affects ovulation. Up to 70% of women with PCOS have something called insulin resistance. Here's what that means. Insulin is the hormone that helps sugar enter your cells for energy. When your cells stop responding properly, your body produces more insulin. High insulin triggers the ovaries to make more androgens. High androgens interfere with ovulation. This creates a vicious cycle. High insulin, high male hormones, disrupted ovulation. This is why PCOS is not just about ovaries, it's about metabolism. The good news? Insulin resistance can improve, and when it does, ovulation often improves too. Can you get pregnant naturally with PCOS? Now let's answer the question you came here for. Can you get pregnant naturally with PCOS? Yes, absolutely. Many women do. But here's the honest truth. Natural pregnancy with PCOS becomes more likely when hormones are balanced, insulin is controlled, inflammation is reduced, ovulation is supported. PCOS doesn't block pregnancy. It just requires a more intentional approach. Weight, PCOS, and fertility. The real science. This is a sensitive topic, so let's talk about it respectfully. Not all women with PCOS are overweight, and thin women can still have insulin resistance. But for women who do carry excess weight, losing just 5 to 10% of body weight can restore ovulation. That's often 10 to 15 pounds. Not extreme dieting, not perfection. Small changes can make a huge hormonal difference. This isn't about blame, it's about biology. Natural ways to support fertility with PCOS. 1. Nutrition for hormone balance. There's no one perfect PCOS diet, but successful plans share similarities. Reduce refined carbs and sugar, focus on protein, eat healthy fats, increase fiber, choose anti-inflammatory foods. Stable blood sugar equals better ovulation signals. 2. Exercise the right way. Too much intense cardio can raise stress hormones. No movement worsens insulin resistance. Best options: strength training, walking, Low-impact workouts, consistency over intensity. Exercise improves ovulation, even without weight loss. 3. Stress, sleep, and fertility. Chronic stress raises cortisol. High cortisol interferes with progesterone. Low progesterone affects ovulation and implantation. Sleep is not optional for fertility. Your nervous system is part of your reproductive system. Supplements that may help PCOS fertility. Some supplements are well researched for PCOS support: inositol, vitamin D, omega-3s, magnesium, zinc. These don't replace lifestyle changes, but they can support your body's natural rhythm. Always consult a healthcare professional. Tracking ovulation with PCOS. Standard period apps often fail women with PCOS. Better tracking methods include basal body temperature, cervical mucus patterns, ovulation test strips used carefully. Understanding your cycle gives you control instead of confusion. When natural pregnancy takes longer. Some women with PCOS conceive in months, others take years. Both experiences are valid. If natural methods don't work, medical support is not failure. PCOS responds very well to fertility treatments. Ovulation induction has high success rates. PCOS is one of the most treatable causes of infertility. If you have PCOS, your body is not broken. It communicates differently, and when you understand its signals, pregnancy is still possible. PCOS may slow the journey, but it does not erase the destination. If this video helped you, like the video. Comment PCOS if you want more fertility content. Share this with someone who needs hope, and subscribe for more honest health education. Your body deserves understanding, not fear.